Are you suffering from dry, irritated red eyes? I know there are countless eye drops, ointments, and procedures you see in pharmacies, online, or in doctor's offices, and they may or may not work. So I'll go through the best treatment methods that are backed by real science and hopefully save you some money. In this video, I'm going to share with you an inside look at how I manage dry eye disease, from how I evaluate it to my treatment algorithm, and all the secrets I've learned the hard way after treating thousands of patients with the disease. My approach has been honed by trial and error over several years, so I want to show you exactly how I approach this condition. By the end of this video, I want you to know as much about dry eye disease as the eye doctor helping you treat it. By the way, I'm Dr. Michael Chua. I'm a board-certified ophthalmologist with Point of Hills Eye Care, and I make videos to help you see better, look better, and feel better too. So the first thing I'll mention is that each patient with dry eye disease is unique and requires a customized treatment plan based on a variety of factors, including the severity of the dry eye, the subtype of their dry eye, their underlying medical conditions, their work and home environment, their risk tolerance to try more invasive treatments, and even their budget. It would be great if there was a one-size-fits-all approach to treat everyone the same way, but we know that would lead to suboptimal results. The first step in the dry eye treatment process is the diagnostic evaluation. Patients usually mention that their eyes feel dry, they feel irritated or gritty, and they feel like there's sand in there. They'll say that sometimes their eyes feel sore, but sometimes they'll also have sharp stabbing pain throughout the day. But that's only the tip of the iceberg for me. There are so many components of each person's dry eye story that we really need to investigate to really understand the underlying causes. For example, are the symptoms worse first thing in the morning? That might suggest that your eyes don't close all the way when you sleep, a condition we call ophthalmos. So if your eyes aren't closing all the way, they'll dry out overnight, and maybe you'll need to use an eye ointment at night or even tape your eyelids closed. Or are you noticing that the symptoms are worse maybe after working on the computer or watching TV for long periods of time? Then it's possible that digital eye strain and all this screen time is one of the culprits for worsening your symptoms. Research studies show that when we're focusing on screens or even books, that our blink rate drops significantly, from a normal of about 20 times a minute down to 5 to 7 times per minute. These long periods between blinks can dry out our eyes and make dry eye symptoms worse. Another factor I consider is your environment. Do you work or live in a dry environment? Maybe your office runs the air conditioning all day and it dries out the room you're in. Or maybe you live in Arizona or California where we have lots of dry heat. In those cases, maybe we need to try to optimize your environment by getting you set up with a humidifier so you can control the moisture in the air around you. And what about your medications? Certain medications like retinoids, certain antidepressants, antihistamines, hormone replacement therapy, and pain relievers. These medications have been shown in several studies to be associated with worsened dry eye. If we identify some of your medications as potential culprits of your worsened dry eye symptoms, then we may want to coordinate with your other doctors on how we can make sure you get the medications you need for your other medical conditions while also being cognizant of your dry eye status. And of course, we have to factor in your own personal medical history. It's important for me to know if you have a history of autoimmune disease like rheumatoid arthritis, lupus, or Sjogren's disease, as these diseases are associated with worsened dry eye as well as eye inflammation. So if you have a history of autoimmune disease, I'll be more likely to be a little bit more aggressive in trying to control the eye inflammation contributing to your dry eye. And as you can see, I'm trying to collect a lot of information before I even take a look at your eyes. Because what I see all the time is that our lifestyle, our environment, our medications, and our medical history all contribute significantly to dry eye syndrome. So after collecting a detailed history, we can start our exam. I'll take a look with our slit lamp microscope and I'll be checking for things like your tear breakup time, or basically how long it takes for your tear film to evaporate from the front of your eyes. Generally, your tear film should still be coating your cornea 10 seconds or longer after you open your eyes. But in some patients with a poor quality tear film, those tears can evaporate after just 2 to 4 seconds, which will leave the cornea vulnerable. I'll also check to see if there's any breakdown in the epithelium or the outer surface of the cornea. This would be a finding we call punctate epithelial erosions, and it's a very common finding in patients with dry eye. I'll also take a good look at the eyelid margin and the meibomian glands along the eyelids. If the meibomian glands are clogged and inflamed, then I know we'll need to make sure we address meibomian gland dysfunction in our treatment regimen. If I see signs of blepharitis or ocular rosacea, such as flaking or crusting along the eyelashes or dilated blood vessels along the eyelids, then I know we'll need to address those conditions as well. And while examining the eyelid, I would also check for ophthalmos, or like we mentioned before, the eyelid's not closing all the way. And I'll also check for what's called floppy eyelid syndrome, which is basically what it sounds like, having excessively lax floppy eyelids. This finding is most commonly found in patients with obstructive sleep apnea, and it's caused by chronic irritation and rubbing of the eyelids in our pillows. It's been shown that patients with obstructive sleep apnea have poor sleep quality, so they're often tossing and turning on their pillows and constantly rubbing their eyes on the pillows as they sleep. This leads to the floppy eyelids and can also cause eye irritation and dryness. So for example, if I find floppy eyelids on exam, I would recommend that the patient see their primary care doctor or a sleep specialist to be evaluated for sleep apnea. Okay, so we've gathered all of the relevant information about a patient's dry eye status, and now we need to come up with a customized treatment plan to help them as much as possible. The general goals of our dry eye treatment plans are to 1. Protect and maintain our tear film, 2. Optimize meibomian gland function, and 3. Decrease inflammation. By accomplishing all 3 of these goals, we have the highest chance of delivering much needed relief to our dry eye patients. And the way I think about dry eye treatment is kind of like a pyramid, which I call the Pragmatic pyramid of dry eye treatment. At the base of our pyramid are the foundational therapies. These are the recommendations I give to almost all of my dry eye patients and are a good starting point for the dry eye regimen. In many of my patients, just through the foundational therapies and lifestyle changes, they feel significant relief from their dry eye symptoms. As severity and frequency of dry eye symptoms increase, or for patients that already have a good foundation of dry eye treatment but are still having symptoms, then I begin to work my way up the pyramid to different treatments that are usually a little bit more involved but can also have better effects. In that second tier, I begin to introduce things like prescription medications, which can be both eye drops or oral medications, as well as procedures like punctal plugs. I usually work with a patient and try a few different options in this tier to see if we can get them some relief. But in cases where the dry eye symptoms are very severe and we've tried a few different treatments in the second tier, then we can move on to the top tier, which I consider my big guns for treating dry eye. These are the slightly more invasive interventions, and they're usually a little bit more expensive as well. So these are the therapies we introduce only after trying a few treatments from the bottom tiers first. So let's work our way up this pyramid, and I'll walk you through the thought process behind each treatment recommendation. The first component of our dry eye treatment journey is setting up the foundation. These treatments will serve as the anchors for all the possible additional medications and procedures that follow. And like I mentioned earlier, just optimizing the foundation of our tear film gives a lot of patients enough relief that they don't even need to move further up the treatment pyramid. Our foundation is composed of the 3 L's. 1. Lubricating eye drops. 2. Lifestyle and environment optimization. And 3. Lid hygiene. The first step is an effective lubricating eye drop. Now, I go into a deep dive into the different eye drops in a previous video here, but briefly, we want an eye drop that allows us to rejuvenate all 3 layers of the tear film. Remember that we all have a tear film that forms a protective layer over the cornea or the front surface of the eye. And the tear film is composed of 3 layers. The mucin layer, which stabilizes the tear film and allows it to spread evenly over the surface of the eye. The aqueous layer, or the water layer, which lubricates the eye and washes away debris. And the oil layer, which seals the tear layer and prevents tears from evaporating too quickly. If any of these 3 layers is compromised, then the whole tear film can break down, leaving the cornea exposed and vulnerable to damage from dry eye. So we want an eye drop that helps to restore all 3 layers of the tear film, particularly the oil layer, because that's what prevents our tears from evaporating. We also generally want to avoid preservatives in our eye drops, because the preservatives commonly used in eye drops called benzalkonium chloride or BAK can cause inflammation and irritation to our eyes if the eye drops are used frequently for long periods of time. The 2 eye drops that check all these boxes for me are Systane Complete Preservative Free and Retain MGD eye drops. So those are the drops I usually recommend for patients to start with. By the way, full transparency, I have zero financial relationship with any of the products I'll mention in this video. I have no affiliate links, I have no products to sell you. These are just the products I've seen make a big difference in dry eye symptoms for my patients. Okay, next we want to take a look at lifestyle and environmental modifications. We want to make sure that your local environment is not worsening your dry eye symptoms. What's the local humidity in the rooms you're staying in? If you happen to spend a lot of time in dry environments, for example, in a room where the air conditioning might be running all day, or if you live in a dry environment like the southwestern United States, then the dryness of your environment is likely contributing to your eye dryness. Ideally, your room humidity should be around 45% for eye moisture. So you can measure your local humidity with a hygrometer, which is basically a humidity sensor. They can be purchased pretty cheaply at places like Amazon or Walmart. If you're in a dry environment, you can even get a humidifier with a built-in hygrometer, so you can set the humidity you want, and the humidifier will adjust its mist output to help you get your preset humidity levels. Another factor we discussed is screen time. I mean, you're watching this video on a screen right now. If you had to guess, how many hours per day would you say you're spending looking at screens? According to a 2023 report from Data Reportal, the average American spends 7 hours and 4 minutes looking at screens per day, while globally, average screen time is 6 hours and 58 minutes. Unfortunately, all this extra screen time is also causing an explosion in the prevalence of dry eye syndrome. In this study, published in the journal Ophthalmology, a research team from Tokyo studied 3,549 office workers and found that people who spent 4 or more hours of screen time had a 68% increase in the odds of having dry eye disease. Now, what's the reason for screen time causing dry eye? It comes down to blink rate. Every time we blink our eyes, our eyelids help to spread a layer of tears over our corneas. If our eyes stay open for a long period of time, then the tear film breaks down and evaporates, leaving our cornea exposed and vulnerable to surface breakdown. One study from the New England Journal of Medicine found that when we're resting or relaxing, our average blink rate is about 22 blinks per minute. While reading books, it's about 10 times per minute. And while reading text on a video screen, it drops down to about 7 times per minute. And so the intervention I recommend to patients, it's simple, but it's easy to forget. They're blink breaks. You have to be deliberate about getting good quality blinks in because it's really easy. It's human nature, actually, to forget to blink when you're watching something on a screen or concentrating on a visually demanding task. One tip ophthalmologists recommend is the 20-20-20 rule. That is, every 20 minutes, take a 20-second blink break and stare out into the distance on an object about 20 yards away. Those blinks will help to restore your tear film and protect your eyes from dryness. Okay, so we discussed artificial tears and lifestyle modifications to help you with your dry eye. The last component of our dry eye treatment foundation is eyelid hygiene. The reason why it's so important to take care of our eyelids is because we want to make sure that our meibomian glands are functioning properly. We all have small glands in the eyelids called meibomian glands. They release oil, which is called meibum, into the tears, which helps to prevent tears from evaporating. Sometimes these glands can get inflamed or clogged, and the glands are unable to release their oily secretions. If these glands become blocked, then there can be decreased oil or lipids in the tear film, causing tears to evaporate quickly. And poorly functioned meibomian glands are extremely common in patients with dry eye. One study found that 86% of patients with dry eye have a component of meibomian gland dysfunction. And based on my experience, I agree. I would estimate around 90% of the patients I see with dry eye at least have some component of poorly functioning meibomian glands. So how can we maintain and rejuvenate our meibomian gland function? We need to use two key therapies, heat and massage. At this point, there are dozens of studies which have all shown that eyelid warm compresses significantly improve signs and symptoms of dry eye. But in order for the warm compress to work, it needs to be done correctly. I go in depth and test different ways to use warm compresses in a previous video here. But briefly, the ideal temperature to liquefy all the oily secretions in our meibomian glands is 41 degrees Celsius or 105 degrees Fahrenheit. When our meibomian glands are clogged up, the secretions can harden and solidify, like butter in a cold refrigerator. But if we apply adequate amounts of heat to our glands, we can help soften and liquefy the oil inside our glands, so it has a consistency more similar to olive oil. This allows the oil from our meibomian glands to run freely and coat our corneas to protect them from dry eye. One of the most consistent, efficient, and cost-effective ways to do this is by using an electrical warm compress device, such as the Aroma Season Therapy device that you can find on Amazon. You can use this warm compress 20 minutes once or twice a day. And immediately after finishing your warm compress, you want to perform some really strong blinks. As you blink, you squeeze the muscles around your eyelids, the orbicularis muscles, and the muscle fibers help to naturally pump out the oil from your meibomian glands. After you perform some good blinks, we want to use our hands and fingers to manually express the glands. What you want to do is first wash your hands with soap and water, then dry them. Then use your non-dominant hand to apply counter traction at your eyebrow. If you're not anchoring your eyelid skin on your bony brow, then your skin will kind of just flop around as you massage it. Then you want to gently use your finger to push down along your glands. A key thing here is not to push inwards. You don't want to be pushing into your eyeball. You want to just be pressing up and down along your eyelid glands. And you can just slowly move from one side to the other. Then you can repeat the process for your lower eyelid. This optimized warm compress regimen of heating up your eyelids to just the right temperature to liquefy all the natural oils in our meibomian glands, followed by gentle massage, will help to keep your meibomian glands functioning properly and also help to maintain your tear film. And you'll probably notice that I don't really recommend thermal in-office procedures like LipiFlow or tear care in my treatment options. These procedures usually cost anywhere from $750 to $1,000 per session and are done in a doctor's office. The basic premise of these procedures is that they use specialized machines to heat up your meibomian glands and then squeeze them to help clear them out and keep the glands flowing. I feel that you can get just as good of an effect by using our optimized warm compress with gentle eyelid massage at home. And the latest research backs this up. This report, published by the American Academy of Ophthalmology in August 2023, reviewed all the prior studies on the use of LipiFlow, or one of those in-office dry eye treatment procedures. After tallying up all the studies, they found that several of the studies comparing LipiFlow to regular eyelid hygiene, consisting of warm compress and eyelid massage, were either sponsored or directly supported by the companies that manufacture the devices. But if they removed those studies, which obviously would have potential for financial conflicts of interest, and only included studies without financial support from corporations, they found that treatment with these specialized devices was not significantly different from eyelid hygiene control treatment. So the research reflects my own experience, which tells me that you can just save your money from spending thousands of dollars on in-office procedures and just do the warm compress at home and still enjoy a similar effect. One last recommendation for our foundational section are lid wipes. If you notice that you have flakes along your eyelashes or the edge of your eyelids are swollen and inflamed, it might be a sign that you have blepharitis. Blepharitis is very common in patients with dry eye, and it makes dry eye symptoms worse. So for my patients who have blepharitis, I recommend they use a lid wipe, like the OcuSoft lid wipes, twice a day to clean out the crusts and bacteria causing the inflammation along their eyelids and eyes. Okay, so that was the foundation of the Pragmatic pyramid of dry eye treatment. Usually, I have patients try these foundational treatments for at least a month or two to see how they're feeling. If patients have used these treatments and are still suffering from dry eye symptoms, then we can move on to the second tier. And as we mentioned before, as we go up the pyramid, we're going to see treatment options that are slightly more expensive and invasive. This is why I usually use a stepwise approach and try the cheaper, less invasive options in the foundation first before trying these treatment methods. And before we go into more dry eye treatment options, I wanted to quickly tell you about my optimized newsletter. If you want science-backed tips to improve your health and your vision, feel free to visit for my optimized newsletter at michaelchuamd.com. Okay, back to the dry eye treatment options. The second tier of treatments I call is a 3P tier because it's anchored by three main types of treatments: prescriptions, punctal plugs, and preservation of tears. Let's dive into these one by one and go through my thought process as we try to solve dry eye syndrome. So let's start with prescription medications. The most common prescription medication I write for dry eye disease is cyclosporin. Cyclosporin is most commonly prescribed under the brand name Restasis, and Restasis is expensive. A 1-month supply of Restasis can cost over $600. But in 2022, the FDA approved the generic version of cyclosporin, which will hopefully drive down the cost of the medication for patients. Cyclosporin is effective for treating dry eye because it's what's called an immunomodulator, meaning that it works to suppress the immune response in the cells around our eyes. What we see in dry eye is that the tear film has either evaporated away or it's broken down, leaving the cells at the surface of our eye, our epithelial cells, exposed to the dry environment. This causes damage to our epithelial cells, and the injured epithelial cells release inflammatory chemicals like cytokines and chemokines. These chemicals trigger our immune system to mount an inflammatory response in our eyes, causing pain, swelling, and grittiness. The problem is that inflammation actually causes further damage to the cells responsible for producing the different components of our tears. So we have a vicious cycle of dry eye causing inflammation, then the inflammation causing damage to our cells, which are supposed to be making our tears, causing more dryness and more inflammation. And research shows that when we can dampen down the inflammation, we can break this vicious cycle and provide patients with dry eye relief. And that's exactly what medications like cyclosporin do. Cyclosporin works to inhibit the activation of immune cells called T lymphocytes around our eyes. By doing so, it reduces the immune-mediated damage to our lacrimal glands, which are the glands that are responsible for producing our tears. So, cyclosporin improves the function of the lacrimal glands, increasing the production of the aqueous component of our tears. Over weeks to months of consistent use, Restasis gradually leads to increased tear production and improved ocular surface moisture, providing relief from dry eye symptoms. I've also found that cyclosporin is particularly effective in patients who have a history of autoimmune diseases like Sjogren's disease or rheumatoid arthritis, because their underlying inflammation is contributing significantly to their dry eye. In terms of side effects, the most common side effect I hear from patients is a burning or stinging sensation after putting in the drops. And I found that if you use an artificial tear a few minutes before using the cyclosporin, it helps to decrease the stinging. Other side effects include red eyes and temporary blurring of the vision as the eye drop spreads over the eye. The other prescription options for dry eye disease that I sometimes write for patients are low-dose steroid eye drops such as loteprednol. Steroids also help to decrease inflammation in the eye, helping to break that cycle of dryness, causing inflammation, causing poor tear production, causing more dryness. The thing to keep in mind with steroid eye drops, though, is that prolonged use of these drops can cause increased eye pressure and earlier development of cataracts. So I usually only recommend that patients use these drops for 1 or 2 weeks when the dry eye flares are severe. We definitely want to avoid patients using these for longer periods of time because of the risk of side effects. Now, there are a few different prescription dry eye medications like Xiidra or Chua or Mibo, but I usually start with generic cyclosporin since it's been around the longest. So its safety has been proven over several years in the real world, and because it's less expensive than the other options. The other prescription medication I'll sometimes reach for is oral azithromycin. Azithromycin is particularly effective for dry eye patients who also have a component of blepharitis. In multiple studies, and in my own experience, azithromycin has been shown to significantly improve blepharitis and meibomian gland dysfunction, as well as dry eye, with a low rate of side effects such as GI upset, nausea, or diarrhea. Okay, Besides prescription medications, the next P in this tier is for punctal plugs. We all have tear ducts, which allows our tears to drain from our eyes to our nose. The openings of these tear ducts are called puncta. We can insert plugs into these openings or puncta to block the drainage of tears from the eye, helping to keep the surface of the eye moist and comfortable. There are two main types of punctal plugs. The first type are absorbable punctal plugs, which are made of collagen and usually last about 3 to 6 months before dissolving. The second type are permanent punctal plugs. These are made of medical-grade plastics such as silicone or acrylic and are meant to stay inside the puncta for years. I usually start with absorbable plugs first with patients for a couple of reasons. The absorbable punctal plugs are placed a little bit deeper in the tear duct, so you can't see them and they're unlikely to cause any irritation. Since permanent punctal plugs rest just at the edge of the puncta, sometimes they can stick out just a little bit and cause rubbing and irritation at the cornea of your eye. The other thing with these permanent plugs is that they can stay in your eye for several years. And after seeing them for several years, I see that they often gradually develop protein buildup and crusts. So you'll need to replace them to a clean pair every few years. The other problem with the plastic permanent plugs is that rarely, if they are a little bit too small, they can get stuck inside the tear duct, causing an obstruction and possibly an infection. And trying to fish out one of these tiny little plugs from someone's tear duct is not fun for the patient or the doctor. So for all these reasons, I usually start with absorbable punctal plugs. Okay, the next P in this level is for preservation of tears. One of the most effective ways to help preserve the tears around our eyes are to wear moisture chamber glasses and goggles. Moisture chamber glasses and goggles basically have these silicone or foam eye cups that hug the skin around the eye, forming a nice little insulated chamber. This helps your eyes retain their moisture and prevents them from drying out. The eye cups also block out wind and other airborne irritants like dust or pollen. The tricky thing with these moisture chamber glasses is that it's all about the fit. You want to have a nice 360-degree seal between the eye cup and your face to make sure that they'll work correctly. Multiple research studies have investigated the effectiveness of moisture chamber glasses, and they all have reached similar conclusions. That is, well-fitting moisture chamber glasses help improve tear film stability and blink rates, and most importantly, decrease symptoms of dry eye disease. One of the more popular moisture glasses manufacturers is Sienna. Full disclosure again, I have zero financial relationship with Sienna. Sienna makes a range of styles of glasses with different fits. They do clear glasses, they do sunglasses, and you can also have them make glasses with your prescription as well. They have great reviews online, but the downside is that their glasses are pricey. Their moisture chamber glasses start at $180, and after you choose different lens options, you could be looking at over $200 just for one pair of glasses. So if you're looking for cheaper alternatives, there are several options on Amazon, but they have more mixed reviews. If you think moisture chamber glasses or goggles might look a little bit too strange or cumbersome, at the very least, you can get a good pair of wraparound sunglasses to help protect your eyes from sunlight, wind, and irritants in the air. They won't work as well as moisture goggles because they don't form a seal around your eyes, but you'll still get a lot of the benefits of the added eye protection from the wind. Okay, so the 3 Ps, prescription medications, punctal plugs, and preserving tears with moisture chamber glasses make up the second tier of interventions we can try as we move up the pragmatic pyramid for dry eye treatment. If I have patients that have tried these previous interventions and are still suffering from dry eye symptoms, then we can move on to the more advanced therapies. One additional option we can try for patients who have difficulty treating dry eye is using amniotic membranes. These amniotic membranes are thin, transparent tissue layers composed of collagen, hyaluronic acid, and several growth factors. Amniotic tissue is actually the innermost layer of the placenta, and it's harvested from the placenta of new mothers after they give birth. This amniotic tissue surrounds developing babies as they grow inside mom for the first 9 months. Amnion is rich in growth factors such as epidermal growth factor and fibroblast growth factors, which are these special molecules that promote cell proliferation, cell development, and tissue repair to help heal any minor injuries or damage that may occur in fetal tissue. Amniotic membranes, with a rich supply of growth factors, have been shown in multiple clinical studies to significantly improve corneal epithelium repair, as well as decrease inflammation at the ocular surface. One study found that patients with moderate to severe dry eye who received ocular surface treatments with amniotic membranes enjoyed symptomatic relief for over 4 months, and these results are in line with my experience. I found that patients who received these amniotic membranes usually mention they have significantly improved symptoms for about 4 to 6 months following the procedure. There are a few types of amniotic membranes, depending on how they are preserved. One common method for preserving the amniotic tissue is called cryopreservation, where the membranes are frozen at very low temperatures to maintain their structural and biological integrity. These cryopreserved amniotic membrane discs can be placed on the eye, followed by a contact lens to make sure it doesn't fall off. The amniotic membranes are usually left in place for about 3 to 7 days and naturally dissolve. Since there's this tissue over the cornea, your vision in that eye will be a little blurry until the contact lens is removed. And since you have that amniotic and contact lens on the eye, you might have a little foreign body sensation while the lens is there. But once the amniotic membrane is dissolved, the cornea has absorbed the growth factors, and the contact lens is removed, patients usually report significantly improved dry eye symptoms for several months. We usually place an amniotic membrane in one eye, then have patients come back a few days later to remove the contact lens from the first eye and to place an amniotic membrane in the second eye. Okay, besides amniotic membranes, another more involved intervention we can try are serum tears. Serum tears, also known as autologous serum tears, are a type of treatment that involves using your own blood serum to create lubricating eye drops. Here's how they work. First, there's the collection of blood. A small amount of your blood is drawn. This blood is processed to isolate the serum, which is the clear liquid portion of blood that remains after the removal of blood cells and clotting factors. Serum tears contain essential components that help lubricate the surface of the eye. These components include growth factors, vitamins, and proteins that are naturally found in our blood. The tears provide a smooth and protective layer over the ocular surface, reducing friction and discomfort associated with dry eye. The growth factors and proteins in serum tears can promote the healing of damaged corneal and conjunctival tissue, as well as decrease inflammation. They can also nourish the cells at the ocular surface, helping to maintain eye health and function. And since serum tears are derived from your own blood, they're highly compatible with your biology. This reduces the risk of allergic reactions or intolerance that can occur with other eye drops. After the serum tears are prepared, they're sent back to you in preservative-free packaging, and you can apply them like any other eye drop. You can probably tell that this is a pretty involved process since you have to get your blood drawn, then your blood needs to be processed into tears and then repacked and sent back to you. And unfortunately, the cost of serum tears reflects this. I've seen companies charge anywhere from $400 to $1,000 for a supply of drops for a few months, depending on where you get your blood drawn and what kind of processing and shipping will be necessary to get the tears to you. Okay, so that rounds out the different treatment options in the Pragmatic Pyramid to dry eye treatment. To summarize, we start with our foundation, which consists of high-quality, preservative-free, artificial tears like Sustain Complete or Retain MGD, as well as an optimized eyelid hygiene regimen consisting of warm compresses and eyelid massage, as well as eyelid wipes if there's a component of blepharitis. We also factor in lifestyle and environmental modifications by remembering the 20-20-20 rule and by trying to limit screen time. And we also try to optimize the local humidity in our homes and our offices by using a humidifier. If these foundational therapies don't work, then we step up to the second tier, where we can try prescription medications like Restasis, we can try punctal plugs, and moisture chamber glasses. And if those treatments don't work, we can step up another tier into the more involved interventions, including amniotic membranes and serum tears. Through patience and some trial and error, we can usually get patient dry eye symptoms under adequate control. This allows them to focus on the more important things in life, like spending time with their families, focusing on work, relaxing, and enjoying life without being constantly bothered by dry eye symptoms. I hope this overview of dry eye symptoms was helpful to you. And if you live in the Los Angeles, Orange County, or Inland Empire area and would like an eye exam, feel free to visit our website or give our phone number a call today. I'm Dr. Michael Chua with Planet Hills Eye Care. See you next time.